Hi everyone, my name is Lindsay Bastian, and today I will be giving a brief presentation on COVID prevention. So, just as a little bit of background about me, I am currently a junior studying environmental engineering and global health here at Arizona State University, and I'm originally from the St. Louis area but moved out to Tempe, Arizona for college. So, when we start talking about COVID prevention, I think something that's really important to bring up is why we should all care and why it's relevant. So, um, something to consider is we all have old family members, we all have people in our life that are more vulnerable than us, and it's important that we protect them and we keep them safe. Additionally, it's your civic duty. It's the American thing to do. To help prevent COVID and help mitigate the spread of COVID. Meanwhile, while the vaccines are being rolled out. So what can you do if you want to work on COVID prevention and you don't really know where to start? So there's three main things that we're going to talk about during this video, and the first is social distancing. So I'm sure that we've all already heard about social distancing, but making sure that you're not around others is so crucial to help mitigate the spread of COVID. And I think it's really also important to hear the science behind why it's 6 feet apart. So it's actually 6 feet apart because that's how far the aerosols travel when we talk or when we breathe or when we sneeze. It's usually around 6 feet, and by around 6 feet, the particles diffuse out and it's not as concentrated, so it's not as much of a threat. And I just thought that's a really cool tidbit of information because it kind of helps you understand where exactly social distancing is coming from, and that it's not made up, it's scientific. So I think something else that's important to talk about is wearing a mask. So also, we all have to go out even if we don't want to. I still have to go get groceries. I still have to attend my lab classes. But when I do have to do those things, I make sure that I wear a mask. So wearing a mask has proven to reduce the amount of particles that we let out into the air, and also countries that have enacted mask mandates earlier on in the pandemic had significantly less cases or severe cases of COVID and less COVID-related deaths. So the data doesn't lie, masks work, and if you do have to be around others, masks are the way to go. I know some people have talked about the difference between masks, but any cloth mask or surgical mask works great. Surgical masks work a little bit better, but the difference is very minute. So make sure you wear a mask when you're around others. And the last thing to do for COVID prevention is to get vaccinated. So I'm sure we are all well aware that vaccines have been rolling out throughout the country, and right now there are educators that are being able to get vaccinated, as well as healthcare workers that have already been getting vaccinated. So those populations are obviously prioritized first for the vaccines, and then more vulnerable populations. But once it is your turn to get vaccinated, that's the right thing to do. That's a good decision. Vaccines can save thousands and thousands of lives, and they are proven to work. And I think it's important to highlight that the vaccines are safe. This is not new science. Vaccines have been developed for a while now, and there are strict regulations and phases that these drugs have to go under to get approved. And the fact that a vaccine has come out and has been created only about a year or so after the pandemic began is not a scary thing. It's a really great thing, and it's great that we have technology and smart people that can do things like that. So in conclusion, if you want to work on COVID prevention and you want to make sure that you are keeping your family safe and keeping yourself safe and healthy, you need to do 3 things: socially distance, wear a mask, and get it vaccinated. So I just want to thank you all for your time. I really enjoyed talking about COVID prevention with you all, and I hope that you feel more prepared in the midst of this pandemic. Thank you.